A healthy population means a healthy economy. I mean, that's a no-brainer, isn't it? The COVID-19 pandemic has reminded just how important good health care is. So let's discuss this. Just what it takes to develop and improve healthcare with Mmopi from McKinsey and Company. Very good morning to you, Matthew. Tell us what we should be looking for here.
Good morning, and thank you very much for the opportunity and the invitation to share some of our findings. So, as you rightly say, COVID-19 is really an unwelcome reminder that health matters and that it actually has very far-reaching ramifications on our lives, in society and our economy. And so, we in our research, we've taken a 20-year view forward-looking to ask ourselves really, how much could the health of people around the world, how much could we improve the health of people all around the world if we make the best use of the health tools and interventions that we know work today, and what would be the economic impact of that? And our results were quite astonishing. Through this analysis, we discovered that we could actually achieve a 40% reduction in the global burden of disease by 2040. And, what that means practically is that there would be 230 million more people alive in 2040 than what we expect. We could actually add around 10 years of healthy life to everyone's middle life, which means basically that the health of a 65-year-old in 2040 would be the equivalent of the health of a 55-year-old today. And so I think that's quite an important finding that we wanted to share. And, from an economic standpoint also, we estimate that, through improving our health as society, we could also have a positive additional impact on the economy, adding roughly $12 trillion to global GDP than what we estimated to be in 2040, which means an additional kind of 0.5% of GDP percentage growth year on year over the next 20 years.
Well, incredible findings, Matthews. I mean, hard to imagine that there can be any more people on the planet, but if you are healthy and fit, then that's okay. What will it take, though, to get these people healthy and fit? I mean, what's needed to get health systems to that point?
Yeah, that's a great question, right? I think the key message is certainly it won't be easy, because if it were, we probably would have solved it already today. But what it means for our healthcare systems is really making a pivot towards not simply treating our health and diseases as they come, but taking a much more preventative orientation to healthcare delivery and also health promotion as well in that regard. And we believe that now is really a unique opportunity and moment for us to engage all stakeholders across private sector, public sector, and civil society around this this opportunity. I mean, I think it's a once in a lifetime or once in a generation opportunity for us to think about healthcare differently, not as a cost, but as an investment with both the social and economic return.
Innovation, I should imagine, is important, yeah?
Absolutely, absolutely. I mean, specifically in terms of what it will take, we have 4 main interventions. I think first we really have to make healthy growth a social and economic priority. Secondly, we have to keep health on everyone's agenda, including the business community. I have clients now who ask me, how should I be thinking about making tools accessible for their employees to deal with mental health, especially in today's world where we face death and loss and grief, not intermittently, but rather on a frequent day-to-day basis.
Matthew Mmopi, fascinating stuff. We're going to have to leave it there. Thank you for your time.